Okay, we're live. So we're just waiting for some people to join us, but if anybody has already, this is Stand Up Fight Back, and I'm Margot Paez, and my co-host is Carlos Marroquin, and we're here with some amazing guests, but we're just going to wait a few minutes or just a couple of moments, hopefully, just to let everybody wake up and join us. We have a really amazing show, so just if you guys want just a little bit of chatter here, tell us about your day, your morning. You got out of bed, you made it. Thank you. Okay.
Oh, well, thanks for having us.
Yeah, thank you so much.
Yes, thank you so much for having us.
You're
One
welcome.
of the 4 days out of the year I put makeup on, so this is a big deal.
Exactly. Yeah, this is the one day out of the week.
We weren't.
As I get older, there will be more days that I put makeup on, okay?
Well, we're hoping.
Do you want to scare people?
We've got
Halloween.
We've got a lot of people who have tuned in now, so why don't we get started? So again, Happy New Year to everybody. Thank you for joining us. We are now in 2021, so let's hope that this year is better than the last. I'm Margot Paez, scientist, engineer, and occasional journalist, and this is my co-host right below me. That's the amazing grassroots organizer, Carlos Marroquin, and you're watching our weekly Sunday morning show, Stand Up, Fight Back, where we discuss strategy and analysis for the progressive movement. We simulcast on Facebook and YouTube, so please, 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 please share us with your friends, and please subscribe and turn on notifications so you don't miss an episode. Today we have many special guests, not just one. We have Betty Doumas Toto, Maureen Cruise, and Erika Feresten. Oh my gosh, I forgot to ask you how to pronounce your last name, Erika. Could you tell me?
So just think of Ferris, like Ferris wheel, and the number 10, Feresten.
Oh, excellent. Erika Feresten, thank you so much. And they are all here from the Healthcare for All Los Angeles chapter. Carlos, would you mind telling us a little bit about our amazing guests today?
I tell you, I cannot think of better people to have here this morning, especially when it comes down to this very important issue, healthcare, that millions of people, the lack of healthcare that many families don't have. And I tell you, we're excited today because this is going to be a hot topic through this new year. Millions of people are being affected through the pandemic. People have lost their jobs, which means they have lost their healthcare insurance. And I think that you're going to be hearing some very important topic issues relating this big issue from our guests. They've been out there fighting in the front lines. We recently came back from the Rose Parade where we held a press conference. One of the guests maybe Erika will let us know a little bit about that, the success of that. But we're getting started. It's a new year. And again, people are nervous, people are scared, and people are suffering out there. So welcome, ladies.
Thank you.
Thank you.
Thank you. Great to be here.
For having us.
Yes,
so
Erika.
Why don't you just...
let's get started. Want to tell us a little bit about the work that you have been doing here in Los Angeles?
Yeah, so I am honored to be a part of Healthcare for All Los Angeles. I'm a director of the Los Angeles chapter along with Maureen Cruise and co-chair with Betty Doumas Toto, and she also serves on the executive board of the state chapter. And basically, Healthcare for All Los Angeles is a statewide organization, nonprofit, all volunteers, dedicated to achieving a universal healthcare system through single-payer financing, which most of us now know as improved and expanded Medicare for All. And the goal is that all California residents, regardless of employment status, regardless of income level, regardless of age, race, sexual orientation, marital status, immigration status, all have the same high standard comprehensive care. So that the governor and the janitor, we all have the same high quality care. and guaranteed health care. And we do this by eliminating the corporate greed, by getting rid of the predatory for-profit insurance companies. And as you know, in 2017, we had a bill, a single payer bill here in California, SB 562, the Healthy California Act. And if that had passed in 2017, at the end of 2020, our state would have saved $111 billion. So we know that single payer Medicare for all saves money, contrary to what the medical industrial complex and our elected officials who are bought and owned by them will tell you. It saves money and it saves lives. And we are in the middle of a pandemic. So if not now, when? And we are calling on Governor Newsom to make this happen. We have 3 specific demands. Number 1, apply for the necessary state innovation waivers from Health and Human Services within the first 100 days of the Biden administration. Our second demand is to lobby state legislators to introduce a California single-payer Medicare for all bill, and for the governor to promote its passage within the first 100 days of the Biden administration. Now, our California legislature has a super majority of Democrats. Not just a majority, a super majority. So there is not any Republican opposition that would mean anything. They can override it in the House or in the Assembly, and they can override it in the state Senate. So this is a given. And our third demand is that Governor Newsom publicly pledge to the people of California that he will sign this legislation by the end of his term in 2022. And so those are the 3 demands that we are calling for. I know Maureen can tell you more, but Governor Newsom campaigned on single payer. So I'll stop talking and let somebody else take it from here.
Margaret? Yes.
So Maureen, do you want to talk about
I had myself
Governor
on mute, sorry.
Okay.
So Maureen, do you want to talk about how Governor Newsom campaigned on
Oh,
single
well,
payer?
yes. Governor Newsom campaigned. I was at a convention with California nurses, and he said, I'm the governor that's going to bring you single payer. We have a clip of him on our website in October 2017. It's a clip from the National Union of Healthcare Workers, where he says exactly, single payer is the way to go to reduce costs and provide care to everyone. But we have seen, and then when he was elected come January, that rhetoric ended, and he basically turned over the reins to a commission. And as was said by Will Rogers 70 years ago, the only thing that slows progress more than LA traffic is a commission, and that's about it. So it's a distraction, a diversion from the business of actually getting this done. We've had 24,000 Californians die during COVID, but which is a horrible tragedy. And that's partially because we have a for-profit system that is that operates on keeping everything close to the margin and basically understaffing and underfunding anything that isn't making a profit today. So we need to take the profit out. We have an insurance system, not a healthcare system. Insurance in healthcare is a scam. Okay, it's really extortion. It's your money or your life. It's a business program that whose concern is not your or my health, whether we live or die or, get what we need, but it's how much money is there going to be made for the shareholders. And the Affordable Care Act did some good things, but it basically is a Republican pro-insurance program. It was originally a Republican program. It was Romney Care, which was rolled out in Massachusetts. The person that was asked to design the program or help roll it out for the country was in fact on loan from, I believe it was Anthem Insurance, one of their big, CEOs. So we know that, and the Wall Street Journal, the day after Congress approved and Obama signed the Affordable Care Act, the Wall Street Journal had huge headlines, money is going to be made. So I ask you, where does money come from? Where does this money that's going to be made? It comes from us, it comes from our pockets. So, and insurance doesn't belong in a healthcare system. It is an extraction of resources away from the delivery of care. A healthcare system is an investment of our money. It's our money. This is our tax dollars. 70% of all healthcare costs are taxpayer funded. So whether you have healthcare or not, whether you have bargain basement care or penthouse care, whether you're a homeless person on the street who just bought a bottle of water, you bought somebody's healthcare, even if you don't have it. So this is really a scam. It's an extortion industry. And the cost is our lives, our health, our lives. We are #1 in preventable deaths in the world. So it's shameful. Insurance doesn't belong. For-profit does not belong in a healthcare system. Healthcare system is a human right. It's a social good. We all need it. We're all already paying for it, and we need to have it. We need to get rid of the insurance industry, siphoning 30% off the top away from the delivery of care that we need.
Yes.
Wow.
Sorry, so I'm having a connection issue, so it's really hard for me to follow right now. So Carlos, do you mind going ahead and taking lead for a little bit?
Yes.
Well, hopefully my computer stops
Maureen,
heating up.
Lauren.
It's spinning very fast.
Sorry.
You are a registered nurse, right, Maureen?
I'm sorry, what did you say, Carlos? Can you speak louder?
You are a registered nurse.
Yes, I am. I've been away from clinical care for a long time. I worked for LA County Department of Health Services. Basically, that's public health. The clinics, public health began to be decimated in the 1980s. It was decided, of course, that poor people don't need care. I worked at 3 different clinics. By 1995, they were all closed down. So public health was disappeared pretty much on the clinical level, on the level at which people get services. We had lines out the door in those days, and now I'm wondering, where do those people go for care? They don't. So yes, that has been my background. But the last 20 years, I've been working on the both the political and the policy front, volunteering. I was on the state Democratic Party, the Progressive Caucus. I was on the healthcare team. I also was the Los Angeles liaison for the Progressive Democrats of America back in 2004, 2005 for Los Angeles. And I served on the executive board of the state Democratic Party, working on a lot of issues, anti-war for sure, because that's part of what it takes to be healthy, is to be alive, right? So anyway, yes, that's my background.
Yes. Thank you so much. Betty, you have been in the front lines now for quite a bit, fighting for Medicare for all. Tell us where we at right now with this fight. And as it stands right now, we have many political changes that are taking place. But where are we at with the movement for Medicare for all here in California? Okay, well, I'm going to stick to the state, California as a state. Federal is going to be very difficult to pass Medicare for all. There are champions that we are depending on, and some of them are not actually
pulling through for us. So we need to stick to the state. We've always thought that the state would be the way to go. That's what Healthcare for All California and all of the chapters across the state is founded on, is passing a state bill and passing and implementing a healthcare for all by single payer plan. So where we're at right now is that we need to pressure the governor to do certain things in order to get us there. And so we have actually come up with a campaign called California First 100, which basically is demands like Erika laid out that we want and actions that we want the governor to take. The first one being that he apply for state innovation waivers. It is the law. ACA has a 1332 waiver, and there are other waivers as well written into the law that you just merely have to apply to and get, and that will enable us to begin the process to implement a single payer bill. So we need him to do that. And we set up a petition that I actually dropped a link into, or we will be dropping a link into, to sign and for Governor Newsom to actually meet those demands. We can get this done here. We are the 5th largest economy. We're actually as big as Canada is, and in population, and we have the ability, and we have the financial sources. We can get this done here in California. So I would encourage everybody to sign on to this petition, but more so when you go to the petition, you will see some actions that you can actually take, and we will be rolling those out within these first few months in order to demand and to persuade that Governor Newsom, move forward with this. Because listen, like Carlos, at the Rose Bowl, that number, 350,000 people, 24 in the country, 24,000 in California. Our profit-driven, our profit-first healthcare system, has a hand in that number. People cannot get care. People are afraid to go get care. They die. Nurses and healthcare workers, 1,700 have died because they are understaffed and overworked and don't have PPE. This healthcare system right now is driving the COVID pandemic, and it is making it worse, and it's perpetuating it.
Wow. Erika, it's really been really tough for a lot of people out here, especially people that have lost their jobs. They're losing their health care, and it's only going to get worse. Progressives pretty much took California in the primaries. We have a high number of people that believe in healthcare for all. I believe that the numbers are pretty high. What's wrong? What's wrong with these political people here?
So, wow, we were thinking on the same page. I was just thinking about how we took the primaries for Bernie Sanders. And we won it huge, as Bernie Sanders would say, because I believe that we won it so big, they couldn't even suppress it to make us lose the primaries. So, right now, Governor Newsom is facing a recall. And there's a petition out there, and there's about 1 million names signed onto this recall. And similar to, Force the Vote, which is happening right now on the national level. And like Betty said, we focus on the state level because we believe this is the way to achieve single payer. We don't have a lot of hope now that Bernie Sanders is not president elect that we will get it on the national level, but we do believe we can get it on the state level. And the saying is, as California goes, so goes the nation. And but just and we do partner though with national efforts. Like we have partnered with Force the Vote. We are proud to partner and help in that effort. And just like they are basically running a campaign where House progressives would, say to Nancy Pelosi, bring Medicare for all to a vote on the floor, or you don't get our vote. What we have the opportunity to do here is, as Governor Newsom is facing this recall, he's going to need us. He's going to need us progressives. So he can make amends for so far not keeping his promise and do the repair by getting single payer Medicare for all now in California and leading the nation with this. As you said, Carlos, it's about 88% of Democrats support single payer Medicare for all, and about 70% of Republicans do. So, Betty and I are also delegates to the California Democratic Party. Betty is also an elected member of the Los Angeles County Commission. And we're constantly told we have to unify. Well, single payer Medicare for all is quite the unifying issue with those numbers. So we say to Governor Newsom, return the money you've taken from the private hospitals, return the money you've taken from United Healthcare, stop lunching with them, wear a mask, and apply for these waivers, demand that your supermajority Democrat legislature put a single payer bill on your desk within the first 100 days, stand with us and sign it. And not only will we back you for governor of this state, we'll back you because we know you want to run for president too. But you've got to honor your word and give the people Medicare for all now. We are in the middle of a pandemic. This is ridiculous that I and Betty and you, Carlos, and all of us are begging our supermajority Democrats and our Democratic governor to give people health care. So I don't know if I answered your question.
Yeah, and Erika, I mean, you hit on exactly the right points. I think it's fantastic that people are pushing the governor on this issue. And I think, the healthcare system in California has been in disarray for a long time. Even since I was a kid, I remember reading in the late 90s problems about local hospitals like Martin Luther King Hospital. I think it was shut down in the late 90s for a period. And I was actually surprised to see it mentioned in the news because I thought I had no idea that it had been reopened. My mother is also a nurse. She's a nurse practitioner, so she kind of filled me in a little bit. And we were having a conversation about this, and she was like, I don't know how this happened. I was like, but Mom, this has been going on forever. And like, how long is it that we have to wait in the ER to be seen? 6 hours sometimes, 8 hours sometimes. And that's without a pandemic. And my mother was telling me that, some of these hospitals in LA County are so bad. They're so understaffed. They are so undersupplied. When she was still working in the hospital, she was at one of the smaller hospitals, maybe like in El Monte or somewhere around there. And she said she had never seen anything like this where they barely had any supplies. And why? Because it's a privately run system. And she's been a nurse since the 80s, and she has seen the decline where in the hospital she worked at for about 20 years, she saw from how doctors and nurses were respected and treated by the management. They would get like Christmas gifts and bonuses and stuff like that. And were shown that they were important, right? And then suddenly with the HMOs coming in, a lot changed, and all of these cutbacks happen and understaffing, and the fact that we're in the situation now in LA County where we basically cannot treat people, or a doctor for 20 people, you know, this is not because. This is not just because we're in a pandemic or because this is a very contagious virus, which it is, but it is because we do not have a single payer healthcare system, and our government has allowed these corporations, these private companies to come in and destroy our healthcare and basically turn us into something like a developed country where they don't have the resources when, as you stated, we are the 5th largest economy in the world. We're as big as Canada, and Canada has a wonderful healthcare system. So I think that your work and what you're saying and what you guys are doing is so important. I mean, have you also, I mean, I know, Maureen, you're an RN. I mean, have you seen a similar thing like my mother working in the hospitals?
Yes, and the most virulent pandemic disease that we have in this country is unbridled capitalistic greed, and since the 1960s, especially, that has been allowed to take over. And yes, I would say that our professions have been hijacked. Nurses and doctors are before COVID, were undergoing high rates of depression and wishing that they had another profession because of the decisions made about what a person needs, a patient needs, are interfered with by someone sitting in a cubicle at a computer deciding what can and cannot be given to a patient. When it's very frustrating when physicians know what a patient needs and they're denied. It's very frustrating when nurses realize that a patient needs specific services and they're not going to get them. And that's because if it makes money to deny care and to delay care, care will be denied and delayed by a business plan. If money is to be made by giving people something, and this is for those who say, but hey, I have good health care, I have great health care. No, you don't. No one has good health care when the decisions are based on profit. If money is to be made from giving you something you don't need, giving you tests you don't need, giving you surgeries or medicines you really don't need, that puts you at risk. But if it makes money for the insurance industry or for the hospitals, they'll do it. So yes, in fact, the system has been hijacked. The inequality, the healthcare deserts, the decimation of entire communities. We see hospital after hospital going bankrupt and closing because in those communities, we have either a high number of people who have no insurance, especially undocumented folks, undocumented families. People have been living here for 20, 30 years, working, paying taxes, contributing to the community, contributing to the economy, and still not able to receive, to get any kind of ability to get care without paying out of pocket. So we have all of these hospitals that are relying on whose patients are coming into the emergency room, or like St. Francis Hospital in Linwood, which has the largest number of babies born every year, about 5,000. They're in receivership. They're being bought out by these private equity firms who then strip out any department that's not profitable. You have these hospitals whose paying patients are Medi-Cal patients. It's Medicaid nationally, but Medi-Cal in California. That is a very, very low level of reimbursement. They cannot afford to offer services if they're not paid, if the hospital doesn't get enough money. These are the hospitals in communities that are suffering and struggling on every single level of the economy. And they are full of the people who contribute the most to our society, who really do the work to keep California California's economy robust, and they're doing it at the expense of their own rights, their own health. So yes, I've seen this happen, especially when, COVID is an example of why we need public health. And it's not public health just to respond to an emergency, but it's public health to ensure that we have a population that is healthy, that can maintain a certain level of health, so that when an epidemic or a pandemic arrives, we are already prepared. We already have a population that is not suffering and sick and has been denied the care that it takes to keep people healthy. So when something comes along, you already have some level of defense there in your personal health. We are number one in the world, our country, for preventable deaths. We are also number one for preventable illnesses that people wouldn't have in another country, because they have a robust system that keeps people healthy, that maintains health, that promotes health. The incentive here is for a sickness system to get medical treatment after the fact. And that is not a recipe, that is not a prescription for a healthy population. That is not a population that's going to be ready to handle any kind of epidemic or pandemic. And as we can see in COVID too, we are not even honoring the medical personnel that are there to take care of a situation that is now completely out of hand. And that's because it's a just-in-time philosophy. We only have things just when we need them. In 2011, Governor Brown basically let go of $250 million worth of PPE, of mobile healthcare units, of ventilators, portable ventilators that were there ready for any kind of big emergency. He got rid of that. He got rid of that $250 million worth of equipment because he didn't want to spend the $5 million a year that it took to keep that equipment in operating order. So that kind of mentality shows that we have a political problem in this state. We have people parading around calling themselves progressive, and I'm here for you, and hey, I'm the Democrat, who are really not understanding what healthcare is all about.
Right.
They're not understanding it at all. We do not have a financial problem. There have been 22 studies over 30 years that have shown nothing but profit, actually revenue generation, saving money from a single payer system. It's not a policy problem. Every other country in the world does it. My gosh, in the last few years, Vietnam, Tunisia, Rwanda have all adopted national healthcare systems. We are an outlier. We are 47th in the world for quality and access of care, 76th in maternal care. 75 other countries keep their mothers and their babies healthy and alive better than we do. So our system is a disaster. And COVID is pushing a disaster into a state of total collapse. And it's not because of finances, we don't have the money. It's not because we don't know how to do it. It's because we have a corrupt political system. And we have got to start pushing on these people that we have elected to take our tax dollars and spend on our money, on our needs, because that is not happening. And so the time is now. There's no better time, not next year, not 10 years from now. Now's the time. We have to push them and make them do their jobs. They are our employees, and
Right.
we are paying for their health care.
I think it's really important for us to also focus. This is a progressive station, if you will, and I want to speak to progressives. I want to speak to people, because we also have a responsibility to stand for something. Someone that's and I say that because we are about to get into a big fight over Medicare for all here in California. And we need everyone to be on board. We need absolutely everyone. I know we're tired. I know that we're fed up with the political people that are sitting in Sacramento. But the fact of the matter is, this is our time right now. This is the time for us to come together. And Erika, you guys are putting a plan together. How can the people help? What do we need to do as a movement? We need to rise up. We need to expand our base.
I definitely want to talk about this, but I'm going to kick it over to Betty to weigh in on this, and then I will take it in a different direction. But hit it, Betty.
Yeah, I mean, the thing is, it's very difficult to do in-person actions, and activists, you want to hit the streets, you want to get that high visibility. And I thank Carlos for helping us organize our New Year's kickoff to the California First 100, because it's very difficult. And also, and it can sometimes, if you're not careful, or people are not careful, it can pose some sort of risk. But the thing is that we need to do whatever is possible, whatever is within our grasp, to actually message our governor, period. We need to write letters. We need to call. We need to use social media. We need to use all of our tools to message the governor to take action, and take action quickly. Not later, not now is not the time. Now, because we're going to hear some things. This is what's going to happen. They're going to say, we really can't pressure him because he's, he's up for a recall, and we don't want him to get recalled. And we're going to hear, California budget is in the dumpster because of the pandemic. So we can't really push for this. The fact is that we do have money. We can source money. As long as we take the actions and start quickly and moving towards a single payer healthcare system. Like Erika pointed out, this system would have saved about $111 billion if we would have passed our state single payer healthcare bill, SB 562, a couple of years ago. We would have been in a better position to fight this pandemic, because the focus would be more on public health than in profit-driven healthcare system, profit first. So we need to all come together, and we all need to support each other's actions. There are many different organizations that are progressive, the California Progressive Alliance, that believe in these issues. Healthcare for All California and their chapters has been in this fight, I say, unfortunately. For many years, because of our politicians, and we have a great opposition against us. There's tons of money against us. So we need the people. We need to be powered by people. Use your creativity. Join other join organizations that are coming up with any campaign that they're coming up to push this message, and to basically demand of the governor that he take action within the first 100 days to set a course for single payer, and sign that bill by 2022.
Erika, did you want to add something to that?
I mean, there's so many wonderful things being said. That yes, in addition to what Betty is saying, activists, educate yourselves. Educate yourselves as to what single payer is, because single payer is not public option. And I really appreciate, Betty, what you said about the talking points that we're going to be hearing. And you got to be strong against those talking points. They're BS. So educate yourselves as to what single payer Medicare for All is. You can go to our website, hcala.org. That stands for Healthcare for All Los Angeles.org. You can read about what single payer is and what it isn't, because it is not a public option. A public option keeps the insurance companies in play. And it is that is the predatory capitalist model that makes what we have, as Maureen said, our insurance system based on profit, not on care. So educate yourselves. As Betty said, we need people power. Carlos Marroquin has organized the People's Parade since 2010. That would be the parade that followed the corporate Rose Bowl Parade, but it was for the people. This year it was canceled, but thanks to Carlos reaching out and us working with Carlos, we did have a People's Parade, which is what kicked off this California Hundreds First campaign that we're here talking about today. We had our People's Parade where we mourned and paid respects to those who passed from COVID, but also, as Margot pointed out, those who continue to suffer and die under this for-profit insurance scam that this country is calling healthcare, which is really predatory capitalism that profits off of death, suffering, and sickness. Is it, Betty, correct me if I'm wrong, but it was Amy Valella's daughter.
Yes.
Did I get the name right?
Mhm.
It makes me cry every time, but you guys, if you're burners, you probably know who I'm talking about. Her daughter, Shaylin, died after going to the emergency room, and she said that she didn't have insurance, and they turned her away. And she died of something that could have been prevented. And Amy Valella makes the point that, how much would you pay for a cell phone? $50, $100, $250, whatever the market says, that's capitalism, you pay for it. But what would you pay for your child's life? For your cousin's life? For your dad's life? You would pay everything and beyond. And they know that. And that is the predatory capitalism that is running our healthcare system. And, I'm angry. I am angry. And there's a lot of, blame going around at Jimmy Dore and other people who are angry. But if you're not angry, there is something wrong with you. And I want the progressives and the progressive organizations to understand that this is life and death and people are dying. It's not a game. And it's interesting that a lot of people leading our progressive movements have the privilege that I have, white, economic privilege, and they're not getting, because they're comfortable, that there's no room to be polite. If you took your child into the emergency room who was suffering from an asthma attack and couldn't breathe, and they were turning you away, would you be polite? I doubt it. I know I and every parent watching would do anything to get their child an inhaler or help them breathe. And that is where you have to be. If you're going to be in this movement, then that's the mindset that you have to be in. And the other thing that I just wanted to talk about a little bit is, I don't know if you can see it, but I've got my Black Lives Matter pen. And I so appreciate White People for Black Lives that's teaching me how to be an anti-racist. And so as Margot, as you said earlier, this is not a new healthcare crisis. We have been in a healthcare crisis for a long, long time. But what COVID is doing, just like what cell phones are doing, exposing police violence and police murdering Black people and Latinx people, this COVID is that video camera that is exposing the racist, capitalist system that has had so many people in crisis long before COVID. COVID is showing that Black people are being hospitalized and dying at 5 times the rate of white people. And why is that? It's because of the racism that has been going on long before. You talked about Martin Luther King Community Hospital. These hospitals are underfunded. These hospitals are understaffed. You know, most of our Black people are Latinx people. They are, you know, essential workers. They are on the front lines. They don't have the income to work from home. They don't have the privilege to just not work. So this is where you see all of these things coming, you know, being highlighted that have been happening for a long, long time. And people like Maureen have been in this fight. People like Akili from Black Lives Matter, people like Dr. Paul Song from PNHP, people like David Mankawa from PANA, Progressive Asian Network for Action, have been in this fight for decades, because this crisis has been going on for decades. It's just now people of privilege, the media, are seeing the inequities. But as Carlos said, we need people. We need the people power, because the money is against us. But we can do this with people power, and look to Black Lives Matter for inspiration. That is people power. They've had the largest demonstrations in the history of the world just recently. They are succeeding. And so take inspiration from Black Lives Matter, join Black Lives Matter, educate yourselves as to what single payer is. Go to our website, hcala.org, sign the petition, and you know, get ready. It's been a long battle. So take breaks when you need to, but toughen up and get in the fight and stay in the fight for as long as it takes, because people are dying. People are losing their homes, their life savings. We had at the People's Parade, David Mankawa shared a story. His grandson died the day before we had this event, and he showed up to speak. Now, if we had single payer healthcare for all, that his grandson may have passed away anyway. But what his daughter-in-law and son wouldn't be facing if we had single payer healthcare is, not only did they lose their child now, and they have insurance, but the copays that they are going to be responsible for, the deductibles, the out-of-network costs. Their child was in the ICU, and it costs $5,000 a day. So now they are going to lose their savings. They might lose where they live. I mean, people are double victims. People are victims first at the hands of the for-profit medical industrial complex, and then they're victims again with being in debt, going bankrupt. Medical bankruptcy is a term that Canadians don't know. Our neighbors to the north, as Betty pointed out, have an amazing healthcare system, have the population of California, but you know what they don't have? They don't have the GDP of California. Our GDP is, I don't know, 2 times, 3 times larger than that of Canada. So again, this is not a money issue. Single payer Medicare for all saves lives. This is an issue, and I'll disagree with you here on Maureen. I think you were being polite. You said that our politicians, maybe they don't know They
No,
don't
I didn't say
understand
that.
single payer.
They know. They
We
know.
know.
They know.
But they
And if
but
they
they
don't, they need
are
to be out of their job because it's the number
they
one
are
concern.
they
If
are
they don't
bought
know,
and
they need to be
owned.
out. Okay. They know.
They are
No, they
bought
know.
and owned by the medical industrial complex, and they need to free themselves. They need to find freedom by giving back that money that they've taken, by refusing to take that money. They need to save their souls and stand in and claim their freedom to speak truth and seek justice and stand with us and give people health care in the middle of the pandemic.
Erika, you're so right, and I'm so glad that you brought up Black Lives Matter movement, because we're not just even talking about having access to healthcare. It's a whole system that's a problem, because one of the issues of BLM is the police brutality, and abolish the police, bring in more social services, defund it, put it into those areas, because people who are in a mental health crisis often are murdered by the police because they are not trained to deal with people in crisis. And we cannot have that. You become afraid to call for help because you don't know if your loved one is going to be murdered, when all you wanted was for them to be taken to the emergency room to get them the help that they need. So you're absolutely right. We really need to see this as a systemic fight. It's not just one thing, it's many things. The entire system has a problem. And again, you are exactly right. The politicians, they do know what's going on, and they have made this choice in the same way that these corporations, the board of directors and their chairs, they've all decided that making a little bit more money is better for them than making sure that people have health care and are not denied the care that they deserve. Carlos,
Betty,
go
sorry,
ahead.
I just want to say one thing. Betty made a great point the other day, which was just as, I choose to stand in solidarity with the Black Freedom Movement. And Betty made the point the other day that when our politicians do choose to deny people health care, they are choosing to let people die and suffer. They are choosing racism. They are choosing classism. And so, sorry, Betty, to take your words, but it was a point you made the other day that I wanted to highlight. So anyway, Margot, you were saying something.
Well, it's super important for us because we're running out of time really quickly, but it's super, super important for us to do certain things moving forward. We have to keep pressing on. We cannot, go back and get discouraged. We gotta press on. My commitment to you, to the movement for Medicare, for healthcare for all, is I'm going to be there for you guys. But all of us need to do that. All of us need to do that. I want to make sure that we are fighting for everyone else, and that it's time. It's just time right now. So moving forward, what can we do for you? How can we help the movement here in California? Let's be very specific. Let's ask the piece stuff that you need them to do.
Okay. Well, I'm just going to repeat what I said, is to definitely join us in the California First 100 campaign. There will be other organizations also rolling out actions. The California Nurses Association will be having an action in February, which will be basically caravans around the Capitol and caravans all across the state to point out the need for a California healthcare system. So you keep your eyes out for that and support that. And keep up with healthcare for all Los Angeles and California, because we will be rolling out actions on a periodic way, probably possibly weekly, bi-weekly, on something that you can do to take action. We'll probably have text banking and phone banking. We will probably have letter writing. We will have social media blasts. We'll give you the tools to do these things so that it's easy for you to take action. And we need to be all of this together and support everything. It's not just one either or. It's whatever we could do that sticks. Something's going to stick.
Yeah.
So let's all
And
do
we
it.
have our petition. We have our
There's
petition
a
that
petition,
Betty
but
dropped.
I want to interject. There's also a couple of things coming up. On the 18th, January 18th, we are going to do another car caravan with Martin Luther King Coalition and Union del Barrio and some other groups that will be starting at Pershing Square, I believe. So please get on our website, contact us, and let us know if you want more information about that. Also, this week, South of LA has made available, and we'll put it on our website. They have made available the film, The Power to Heal, that shows the influence of the civil rights movement on opening up the hospitals and getting rid of the segregation in the hospitals. And that film will be online, and it'll be free for you to see up until I believe it is the 9th, that you'll be able to see that this coming week. So those are a couple of things that are happening right now, and that will educate you quite a bit.
I also would like to say that you can request for a speaker engagement for educating your organization. If it's not a single payer or healthcare for all organization, and you need, you want to hear more about not only a campaign, but what it's all about, what it's not. Like, it's not a public option, because public option perpetuates insurance companies and for profits. So if you do that, just go to our website, hit the contact and contact us and request somebody to have a Zoom meeting. We don't have to do this in person right now. We could actually have the ability to reach more people over over live streaming and Zoom and your platform here. So definitely, so we can give you all the things that you need to be educated on the subject, so that when you talk to your representatives about this, when you talk to your family and your friends, you have some of that information on hand. So definitely do that, because the education is key. These politicians are tricky. They trick you, and they try to step you up, and they tell you different excuses. So you'll have a talking point or two to grab out, and we'll educate you on that. But definitely, please go to the petition and sign that, because they have other things in there that you could do to take action when you go into the petition.
Thank you. So we have a few more minutes, and I just wanted to emphasize something before we sign off, and that's that a lot of people, I'm starting to hear things from some people, some progressives, where they're, and I heard this more on the climate change side, where they're saying, like, under this Congress, under this government that's coming in, that we're not going to be able to get everything we want. And we have to just kind of start, even though we want this and this and this, we kind of have to start thinking about what we can get. And on the one hand, you can say, like, yeah, okay, I kind of see your point. But I think that really it's basically you're giving in already. You're saying, you're accepting that you're not going to get what we need and what we deserve. And so I really want to push people to not think that way, because everything is at stake right now. This is 2021. Bernie Sanders first ran in 2016. That was the first time we really started talking about Medicare for all on the national level. That was the first time we really started talking about income inequality and the wealth gap on the national level since Occupy. That was the first time we really started seeing what the climate crisis was ahead of us and is ahead of us and is not that far in the future. And we cannot, now is not the time to compromise. Now is not the time to step back and say, well, this is the best we can do. Because if we do that, if we just say this is the best we can do, then we don't have a future.
That's
The
right.
future is unwritten, but there are clear paths. And one path is this sort of subservient, we'll just take whatever these rich people and these corporations toss at us, right?
Mhm.
And the other one is we fight, and we fight until we cannot fight. And the truth is that this is a difficult fight. And it is true that we may not win this fight. We don't know. But we have to try. It's more important for us to try our best to do this, to give it everything we can, for everybody to come in together as one people in this country and globally, than to just throw in the towel without trying because we think we might lose. It is more important for us to fight than to lose. Go ahead.
May I add a quote from Muhammad Ali?
Absolutely.
Muhammad Ali said, the word impossible. Impossible is a big word thrown around by small men who would rather accept what is given them than fight for what they need. Impossible is an opinion. Impossible is not reality. Impossible means nothing. And why are we begging from the people that we have hired by election to do what we want them to do and then say, oh, well, they won't do it? No.
Now is the time to stand up and fight back, like your show
Fight.
says.
Yeah, stand up and fight back.
It's an opinion,
Stand up and fight back, and much respect for Maureen, because she's like, she is a mentor to me, and I respect everything, all of her knowledge. And if you want a piece of that knowledge, go to our website and we'll come and speak to you. And it's just incredible. Thank you all for having us. This is so important to.
And just remember, accepting the status quo means that we agree that people need to go on GoFundMe and beg money from complete and total strangers so they don't die. What kind of world is that? And if we accept the status quo, that is what we are accepting as the norm. We can't. If we're decent human beings, we can't.
Absolutely. Carlos, do you have any last thoughts?
Well, I just want to say thank you for your hard work, your commitment, for.
Oh, we just lost him. Okay, well, let's give him a moment to come back. Is everybody still here? Okay.
We're still here. Well, thank you, Margot, for this show, and thank you, Carlos. I even though you can't hear us, we really appreciate the work that you guys are doing.
I'll pop him back in. Carlos, you're back.
Well, I left you guys for a minute, but I want to say thank you for your commitment in making sure that this movement keeps going forward. I am standing with you guys with this movement, and anything that I can do, I'm here for you guys. And I'm sure that there's other around the state that feel the same way. This is our time, and we're going to rise up.
Yes. And just to remind our viewers that, we focus today a lot on what's happening in California with the healthcare system and the push for Medicare for all here. But this is not just a California issue. This is a national issue. And wherever you live in this country, you also can do something there, and you must do something there. Do whatever you can, whether it's protesting, whether it's a petition, calling your representatives, or running for office, which I highly recommend, because you who are watching this show are much better than the politicians who are in office right now. So thank you, all of you, for joining us. Thank you to our guests. Thank you, Carlos. And just a reminder, you've been watching Stand Up, Fight Back.
Stand up, fight back.
Absolutely. I am Margot Pais, co-host, and right below me, that's Carlos Marroquin, the other co-host of this show. This show airs every Sunday at 10 a.m., and we're testing out the 6 p.m. slot. Tonight, we will not be doing the 6 p.m. slot, but I believe that Carlos and I are thinking about doing something on Tuesday to discuss the results as they come in Georgia with the Senate runoffs, because I know everybody's very excited to find out what happens there. So look out for any posting about that. Again, we broadcast live, and we do this on the Bernie Sanders Brigade page and on the Inside Out News page and YouTube page. So please tune in. Please share us with your friends. Please subscribe. And as we said, stand up, fight back. This is all on you and our progressive movement. We'll see you next time. Have a great week, and Happy New Year to everybody.